Some students in Achimota School are pleading with school authorities to grant them access to their wards. Of course, some parents is what I mean, not students. According to them, they have not been given any information on the state of affairs in the school and are not allowed to see their children or take them home. We know that health officials are racing against time to stop further spread of the deadliest variant of COVID-19 yet, after some 134 students and staff of Achimota School tested positive for the virus. The Greater Accra Regional Health Directorate on Monday met with officials and teachers of the school as part of efforts to curb the fast-spreading Delta variant. Let's listen to some parents who spoke on condition of anonymity.
Actually, it's very scary. It's very, very scary because we all heard that the Delta variant is very fast spreading and it kills very fast. So we are expecting the school to reach out to parents to at least come and pick up their wards. At least after the test and then it comes out they are negative, you can allow them to go. Then you quarantine the rest. But you can't keep the kids in school. Parents are worried. We are seriously worried. We don't know what's really going on.
So that means they've not given you any information about what is happening?
We haven't been given any information. All the information we have is what we read in the news. To get an official information from the school, no, we haven't received that.
Okay. And are you allowed to see your kids at this point?
We are not. If you are lucky and you have a teacher around who knows your ward, you can come, leave something with them for them to give it to the kid. But then we've not been able to see the kids, not even hear from them.
As parents, we were hoping by now the school would have at least given us information, updates about the situation going on at the school, because we are all worried. The only updates that we know is from what we hear on the news. We don't know how our wards are faring, we don't know the conditions they are in. And so we're hoping, and we are pleading with the school to at least contact with the parents and give us an assurance that our wards are safe. And if they can dispatch those who haven't contracted the virus home, they should just release them to us. Okay, we'll be very grateful.
Meanwhile, teachers of Achimota School are currently undergoing COVID testing at the school's chapel. This comes after the regional health director announced a compulsory testing regime for all teachers of the school. In a meeting that was held yesterday on the school's COVID situation. Joining us now via Zoom is Dr. Kofi Boni. He's a senior research fellow at Noguchi. Dr. Boni, thank you for your time. The Delta strain is now being recorded in communities. It's now been confirmed at Achimota. Is any of this a surprise to you?
Thank you for the opportunity. Not really a surprise to me as in person, but we knew it was just a matter of time that we will start seeing it in the community. I mean, so long as it has gotten into the country, it was just a matter of time that people will start recording it. So when we started hearing or recording cases from Achimota School, we were not that much surprised.
Right. So tell me this. Because children have not been receiving the vaccine, should we be a bit more concerned that this more virulent strain is now rampaging amongst young children in a place like Achimota?
Yes, we should be very much concerned because the children, if you look at the statistics, most of them will not fall prey. In other words, we may not record fatalities in these cases that we are getting. But then they will have the ability to spread the virus to other people. And if these other people that we are talking about constitute the larger proportion that we talk about, the vulnerable group, then that is where we have that concern. So we should be really concerned. And then all the measures that has to be put in place to try and curtail the spread will have to be done as soon as we can so that we don't cause more problems to other people, especially the vulnerable group.
Now, this strain was deadly in India. They are still reaping the whirlwind as a result of it. Here in Ghana, though, should we be doing something different? I mean, we've not heard any information from our leaders in the health sector that we should be doing something specifically different to prevent its spread. Are we taking it for granted?
No, I think they've come out with a lot of information. In fact, some of us were initially of the view that when people who were coming in through the airport, I mean, especially from the high-risk areas, India and the like, yes, they may test negative with the antibody testing that they are doing at the airport, but we're thinking they will be held, I mean, in quarantine for some time. And whilst they are there, maybe if it's for a week, they will take maybe a series of tests, maybe 1 or 2, so that before they get into the community, then we are sure that these people are not having the virus, or they are not going to spread. Because you see, we are dealing with a virus that has an incubation period, a period where we have the virus proliferating in the system, the human system. So if you show up as negative, it doesn't necessarily mean that you are negative for the virus or for the period of time that you're going to be around. So if you keep you for maybe a week, thereabout, and we do a test before we let you join the others in the community, then we are sure that we are not going to have any of these viruses getting into the community. But now we have it in the community, so we have to look forward to see how best we can stop the spread. That was the view I had.
Well, I mean, Dr. Bonnie, even this suggestion that you're making is not one that has been adopted. We don't know if it's being considered. The point is, what is being done differently? What are we doing differently? We have a different strain, but we are not doing anything different, are we?
Now, I think what they are doing is intensifying what we call the contact tracing, making sure that anybody who has had contact with positive cases recorded will be seen and sample will be taken from them. So initially we used to do close contact, but now I'm very sure that they are doing even casual contact, those who are far off, and they will still do, so long as you have had any kind of interaction with a confirmed case, the sample will be taken. So I think that is what the health service is doing now. That is what I've heard them do now. It is also, if it's done very effectively, we stand a chance of minimizing spread, or more or less stopping the spread of the virus.
Dr. Bonnie, contact tracing comes in after you've identified people who have been infected. Should there be something that we're doing to stop the spread of the infection to begin with, before contact tracing even becomes necessary?
Yeah, I mean, before you do contact tracing, the cases that have been confirmed, I mean, we try as much as possible to isolate. And that's where we isolate. Try not to let them limit their movement into places where we have people who have not maybe come into contact with the virus. Also, you put in the protocols that we have already in the system, making sure that people are wearing their masks, they are keeping away from people. I mean, the social distancing aspect, we have to make sure that we enforce it. And the other protocols that we have in the system has to be, we have to make sure that we implement those ones. So that one will now try to prevent us from getting it. But once it's in the system, we now have to come in with this contact tracing and other efforts that we have to make sure that it doesn't spread. Now it's in the system, so that's what we have to look at. But to prevent, we know as a country, we know all the protocols that we have in place to stop, prevent people from getting the virus.
Out of the 21 odd samples from Achimota that were taken for genome sequencing, 20 of them turned out to be the Delta variant. Now, it's spreading in communities. That has also been determined. But just go to social media and you will see all kinds of events occurring with video evidence. Nightclubs are open, parties are happening. This morning there was a demonstration. Hundreds of people marching through the city, crowding and massing up at Jubilee House and at Parliament. We've had funerals attended by the President himself where people are not observing the COVID-19 protocols. At this point, should we as a nation just accept that the Delta variant is going to spread across the country?
It is alarming. I mean, when you see some of the things that you've mentioned, when you see people doing that, sometimes maybe we tend to, or we are getting to a point where we are forgetting that this virus is still in circulation and people are doing all sorts of things. We are not observing these social distancing practices that we started some time back. It is unfortunate that we see these things, but I think that we should continue with education. I mean, a media house like yours, we shouldn't stop what we used to do, letting people know that we still have this virus circulating. In fact, current information that we have suggests that even we have what is called a Delta plus also in circulation. That is a variant that is even more contagious than the Delta virus itself.
That's also in Ghana?
No, that has not been recorded in Ghana yet.
Right.
But have that Delta plus also now coming up in some countries. But you see, if it's in some countries, it's just a matter of time that it will come to Ghana because we have this international travel and all that. So we should be aware that the virus is still in circulation and we have to be very careful with our protocols that we were observing at first. We need education. Education, I think, is the key. And media houses like yours and others should help to do that. And that will bring people's attention back to what we used to do.
Right. So is it time for us to consider shutting down airports?
Oh, that one I will not say that because that one is for the policymakers to come up with it. But my suggestion, I still hold my view that people coming from high-risk areas, I think it's not enough for them to submit a PCR negative certificate and also do an antigen test at the airport and to be negative. Then we allow them to come into to mix up with the rest of us. I think they need to be held in quarantine for some time and samples taken from them whilst they are there, make sure that they are free before we allow them to join every one of us. Yeah, that is what I think we should be doing.
At the moment, not much more than 1% of the population has been vaccinated. Really, if we get a surge, what are our chances of managing it since we don't even know when we're going to be getting any more vaccines?
Managing it, that's also a question for the policymakers or the ministry but it's going to be difficult. It's going to be difficult because if you look at our health systems and what we have in place, if we should get a surge and we have huge numbers of people going to the hospitals, then I think you and I know what's going to happen because even with developed countries, there were issues. So we are praying that we don't go into a situation like that. That is what we have to pray for. But right. For now, it's up to the policymakers or those who manage the situation. I mean, those who are at the forefront of managing this COVID affairs to come up with strategies, not for us to get there. And should we get there, we have come up with implementation policies or whatever we have to forestall the spread of the virus.
Dr. Kofi Bonny, thank you. Thank you very much for your time. Dr. Bonny, of course, is a senior research fellow at Noguchi Institute. Right, let's have a look at what's happening with COVID-19 across the country. Here's what the dashboard is looking like. 85 new cases. That brings to 1,619 the active cases. So far since the beginning of this pandemic, 96,402 cases have been confirmed in Ghana. 93,987 of them have actually recovered. Sadly, 796 of these cases resulted in death.